Welcome, everybody. I'm here with Chris Wolbert and I'm Zemar, and we're here to try to expand the knowledge of employers, HRs, and CFOs. Thanks, Chris, for joining me. And I think we're excited about joining this topic and try to get information out in the workplace.
Yeah, absolutely, Butch. I'm looking forward to having this conversation around how to provide incentives for your employees and how to really design a plan that incentivizes good behavior, or in our case, directs people to those higher quality doctors, facilities, hospitals, outpatient surgery centers, whatever the case might be. The real goal, I think, is to get people to go to higher quality providers, because we have in healthcare, it's such a opaque, confusing, fragmented, and ultimately expensive system. And nobody really has the resources to figure out who those higher quality providers are. Butch, it's like, I think about, when you show up at a restaurant or on a car lot or whatever else, you kind of have an idea before you get there of the quality of either the car that you're buying or the meal that you're going to have. Mm-hmm. And you also have an idea, because they've got it on a car, they've got it right, they've got a sticker price right on the windshield, and they've got at a restaurant, they've got it right on the menu, ultimately what you're going to pay for that. Well, and that's how it functions in pretty much every area of our economy. But healthcare is an exception to that rule. It's definitely not that way. And so if we can provide the resources and ultimately the incentives for people to seek out that higher quality care without having to do all the legwork themselves, that's where we find we can hit the center of the bullseye. We can eliminate deductibles, co-pays, co-insurance, those types of things. So,
yeah, definitely. And you're 100% right. I always call it the menu board, right? There's no menu board to choose from in the healthcare world. And then if we had that capability, I think many will actually try to make better decisions when they're healthcare. And what people like you and I do is try to provide those solutions so the employer doesn't have to do all the background search, or HR or even the CFO has to jump in. But you had mentioned about limiting deductibles. In today's world, our deductibles are going higher. How is this even possible, right? So some people are like, hey, this could be a fairy tale. So what's your take on that?
Yeah, well, I get that a lot. It's funny that I have heard that fairy tale. I've heard pipe dream. I've heard, when we start to kind of outline what our vision is of how we design a plan. And it's funny because that's exactly what has happened. What you mentioned about rising deductibles, out-of-pocket maxes, those kinds of things. That's what we've seen over the last 10, 15, 20 years, and even longer than that, really. But it's really kind of accelerated these last few years as people are kind of chasing those lower rates. And so there's, I tell HR directors and CFOs and owners all the time, there's no reason why you wouldn't think that you're doing a good job by shopping the market each year and chasing that lower rate. But the problem is, and I think I've seen this, I don't know about you, Butch, but I've seen this, just had a conversation with a president of a 200 life company yesterday. And, and he's just like, man, it just kind of feels like when they bring a 10% increase or they bring an 8% increase or whatever, they're wanting us to jump up and down and thank them for that. And it's like, man, that's crazy. But they've been conditioned to think that if they increase the deductible, it's going to lower their premium. And that's the only way to that's the rat race that they're in, right? Mm-hmm. And so that sometimes is the hardest thing to do, is just simply to show them that, hey, look, this old legacy way of thinking, this traditional kind of approach to this it's not sustainable anymore. We've reached a point where you can't continue to increase the deductibles and still keep people excited about the benefits program. They just see this each year as their pay decrease, or they see it as what wipes out any kind of increase that they've had in their wages or what have you. So that really is the hardest thing sometimes, is to destroy that legacy thinking that they have to increase deductibles in order to lower premiums.
Yeah, and you bring up legacy. I always call it that the industry taught everybody how to shop for their insurance. So it's just this endless cycle, because that's just the way it's always been, especially with these carriers, right? They're always the same, right? They just keep rotating and they're doing the same thing all over again. Before we went live and recorded, you talked about this enhanced tier that I wrote down. And so maybe you could elaborate on that, because I think it's a good conversation to have, because, try to eliminate some of the out-of-pocket and give real good financial incentives for the employees to make better decisions. Can you expand on the enhanced tiers?
Yeah. Well, again, there's this whole like pipe dream thing. Oh, this isn't possible. And the other thing I find too, a lot of times, just to kind of level set here for a moment, what I find a lot of times is that, you and I and others that are kind of in our same ecosystem, talk a lot about breaking the status quo and things like that. And one of the things that I've learned over these years is that sometimes it's like, look, you just need to start with where they're at. And so what I mean by that is typically right now, you've got two tiers on your plan design. You've got your out of network benefits, which is very punitive for anybody to go to a doctor or facility, hospital, whatever, who's out of network. And then you've also got your in network benefits, which is what most people use, where you've got, a deductible co-insurance, co-pays, those types of things. So when we talk about an enhanced tier, when we talk about designing a plan that incentivizes employees, there's really not a lot of magic or it's not a pipe dream. It's, nothing like that. What we do is we start with that same framework that you have out of network and then in network. And then we add an enhanced tier or a kind of a tier one benefit or a preferred, however you want to, market that. But what we do essentially in that case is we say, hey, look, we're going to provide you with the same thing that you've always had, right? We're going to provide you with in-network, out-of-network benefits, but we're going to provide this enhanced tier. And what that means is that you now have a clinical team. Now, whether that's a team of nurses and doctors, AI technology, there's a number of different phenomenal solutions that are on the market that all help to do this. But essentially what their goal is to help guide and direct employees to higher quality doctors, facilities, hospitals, whatever the case is. But for the first time, be able to show employees where those higher quality providers are, and really, to go back to the car dealer analogy, right? Like give them, they can actually spot the difference between a Mercedes-Benz and a Geo Metro, right? They can spot the difference now between, to use that restaurant analogy, a 5-star steakhouse and, fast food, right? Yep. Which they otherwise don't know in healthcare. And so when we can have that team of nurses, doctors, technology solutions, whatever the case might be, they can reach out. It's an optional, thing for people to reach out. They don't have to participate in it. Now, if they do, and they reach out to that team, they can have a team that's actually really, truly their advocate, that's working on their behalf, that's figuring out if the diagnosis is correct, if the prognosis, if the care path, just being that extra set of eyes looking over their doctor's shoulders and making sure that they are going to those higher quality facilities, doctors, et cetera. And if not, providing them additional options that are within the network that are going to be those better options based on clinical outcomes objectively, right? Where it's not like a pay-to-play scheme or something like that, where this is a marketing thing for doctors and facilities. We're looking at CMS data and a number of other things that we're looking at as well to determine those higher quality options that are available. Now, when those employees do opt in for that, and they opt in for that enhanced tier, we can eliminate deductibles, we can eliminate copays, co-insurance, out-of-pocket maxes. However aggressive you want to get as an employer, we can meet that need, right? So that's really what it is just giving them the tools for the first time ever, where they can get their care at no out-of-pocket and know that they're going to a higher quality facility, doctor, hospital, whatever the case might be in their situation, right? And so really that's what's most important there, is getting them to quality first, providing that incentive. But we already know, based on the outcomes, based on all that clinical data that we have, the cost of care is going to be so much lower when they go that direction. So that's what allows us to eliminate deductibles and copays and all that. It seems counterintuitive if the only thing you've ever done is raise deductibles in order to keep premiums low. So when we focus on that quality first, inject that transparency, and provide that incentive for the employee to seek out that care, sure, they're going to do that. And 9 out of 10 times they do that. And for those that don't want to do that, they don't have to. They can use that in-network tier just like they always have, pay their deductible, pay their copays, and never have to talk to any kind of concierge or advocacy team or anything like that at all. So,
yeah. And you bring up several great points that I think CFOs and HR and employers, depending on the situation, should be asking the questions even before the renewal, right? With the current broker, talking about how do the employees manage these claims better, or how do we reduce their out of pocket without jeopardizing quality of healthcare? The billboard or the banner on the hospital is not the best way to figure out what their quality factors are, right? And so these are the questions that should be asked there in the renewal meetings or even throughout the year to the current broker. And if they're not answering those questions, they obviously need to see people like such as yourself, Chris, to make sure, hey, how do we provide these better outcomes? How do we ask the right questions? How do we reduce and possibly eliminate employee out-of-pocket expenses? And then obviously bringing them the quality of care that they deserve. And you as the employer are providing that for them.
Exactly right. And here's the thing that happens with that too. Again, when you kind of break down that barrier of the raising deductibles to lower, premiums and things like that, and the employer starts to see, they start to see cost savings pretty much immediately in the first quarter, particularly if part of what we're attacking, which we haven't even really discussed yet, is prescription drugs, right? So that's the low hanging fruit that everybody, I think, knows that we're overspending in this country on prescription drugs, and employers are certainly not shielded from that. And you hear, oh, rebates, this, no. There's that's a whole nother topic. We could probably do a 2-hour video on that one alone.
Chris, this is definitely great feedback on what employers should be looking for. Here we are when we're recording this is towards the end of June. Renewal season's now for a lot of employers, right? So even though they were January 1st down the road, so you still have 6 months, but it's going to take some time to put these together, maybe walk through a process that you haven't been down before, because we've been taught how to shop and renew our health plans for years, decades.
Yeah, absolutely. And a lot of times, one of the things that I like to look at, particularly with a group that is still fully insured, and this is all new to them. You and I have a lot of experience with this, so we're very confident in the solutions we can deliver and provide. But not every employer is ready to jump in and say, all right, let's go ahead and do this. So sometimes what I find is that, look, it's like, sometimes it's just better to say, hey, look, let's just start you where you're at. We don't necessarily need to make big sweeping changes this year, this renewal. You want to keep the same carrier. You guys want to keep the same plan. That's totally fine. Even if you're fully insured, right? Mm-hmm. Even if you are fully insured, you can still have that enhanced tier. You can still bolt that on. You have to be working with the right solution providers. You have to be working with the right consultants that can bring that to you, that can deliver that, and that can communicate that to your employees, right? Because it's great to have a new kind of shiny object, I guess we'll call it. But if nobody knows about it, nobody knows how to use it, then it's an investment of time and money and energy that is going to fall flat, right? And so, but that's one thing I always love to highlight for employers is that there are so many strategies out there now that can allow you to do that same thing if you start to kind of think outside the box, that big carrier box where you just take a rate, you're prepaying claims for the year, and you just hope and pray that the renewal next year isn't terrible, right? So
very true.
You've got to have those incentives. You've got to have data at your fingertips, and but ultimately you've got to be working with somebody who understands how to bring these solutions to your employee population, so that you can manage your healthcare span just like you do all other areas of your business, right? All the other equipment you purchase, all the other materials and supplies, and whatever the investment is that you need to make. I had an owner one time was telling me about how they were a cabinet making company, and they would negotiate for fractions of a penny for screws and hardware and all these different types of things. And it's like, man, like you can do the same thing for your healthcare spend, but they've just been conditioned that they can't. So yeah.
You bring up a lot of great talking points there, obviously incentives to the employees. And then you had said, well, you got to break down the costs. So we have to blow up the health plan, put it back together. But the other thing is start where you're at, right? So not everybody can move forward and say, okay, we're going to go from A to B like tomorrow, right? But we provide the roadmap. We start moving to, it's just like any other goals in life, right? Like just it's moving in the right direction, and then start taking and attacking those items. If there's items you could check off the list sooner, great, let's go ahead and take care of those. But if not, then we work towards that. And then and hopefully, like you had said, the next year, the programs you put in place may start reversing the trend that was already there. And so we'll have more topics such as these on other recordings that we're going to be doing. One thing that I know you and I wanted to bring up to a lot of people that are listening or watching this video recording is there's a conference coming up, the Employee Benefits News Conference that's happening in Austin. And both of us are on a panel, two different panels. And so, Chris, do you want to talk about the panel you're on and maybe some of the topics that are going to be listed there?
Yeah, so I'm going to be on a panel with my good friend and my partner Eric Silverman, and what we're going to be talking about. The title of our panel is "How to Create a Benefits Shopping Spree." So it kind of dovetails on this conversation we're having now, but again, we're providing a kind of a different view on how to create something that your employees can engage in, so that it's not just, traditionally what we found is that it was a lot of times it would be like somebody like yourself or me sitting in a room with a CFO, HR director, owner, whatever, making decisions that are going to affect hundreds or thousands of people, and they didn't really have they didn't have any say. They didn't have any skin in the game. They didn't have any kind of input on the benefits that are important to them and that are important to their family, or, and so what we like to do is kind of flip all this on its head, if anybody hadn't guessed that so far, but talking about creating a benefits shopping spree where now the employee is empowered to decide what's important to them, right? They may not care about dental. They may not care about vision. They may want disability. They may want life insurance, long-term care, whatever the case is. The point is, as an employer, you don't need to be so paternalistic that you're deciding these things for them. Allow them to make some decisions for themselves. And what it does is it creates a lot more buy-in from them. They feel as though they're part of the process now, right? Which hasn't been the case for the last several years or decades. And you're really empowering them to decide what they want out of their benefits package, what's most important to them. So,
and I'm looking forward to, hopefully I'll be able to step in on that panel. Eric Silverman's obviously a great speaker, very knowledgeable in the industry, as well as Chris. And so that's great. And the panel that I'm on is strategies for brokers of all sizes. And I think it's key, especially in this environment, is that some employers feel like they have to go to national agencies to get all the resources. And there's so many resources that are even available that can be brought down to smaller agencies. You don't need to be big to bring big ideas and big resources to the employer workplace. It doesn't matter if there's thousands, tens of thousands of employees, or just hundreds or even tens of employees. The technology pieces are already there, and there's strategies that get in place that you don't need 100 employee insurance agency or thousands for that matter. I think one of the national ones, yesterday I heard there's like 65,000 employees nationwide. It's like, but you don't need any of that.
Yeah, well, and I think the other thing too that I always like to point out, when because I'm an independent shop just like you, right? One of the things I like to point out is it's like, okay, so you're working with ABC big brokerage, right? So who do you work with over there, right? And it's usually 2 to 3 people. You've got the main broker, maybe kind of a more junior broker, and then you've got an account executive, or you've got a broker, and then you've got maybe 2 account executives. But they've got all these resources. But to your point too, it's like they're spread so thin that unless you're one of these employers that has tens of thousands of employees, you're never going to hear from their ERISA attorney. They're not going to give you the time of day or whatever. I just use that as an example.
Yeah.
But the point is that, you're getting the same thing you can get the same thing from an independent shop as well, where you've got this group of 2 to 3 people. But then, and I know you have this as well as I do, you've got other people that you partner with and things like that in terms of, ERISA attorneys and whatever the case might be. So it's like, gosh, you can get the same thing. So what are you really paying for? That's kind of the question.
Especially with compensation model disclosures coming out and how big shops are paid for. But there's a lot to be had at this employee benefit news conference. And I think it could be advantageous for a lot of HR professionals, CFOs, or employers to listen in, especially between strategies for different things moving forward with the employee benefit programs, as well as like the topics you brought up where, getting the employees engaged and, different shopping experience when it comes to their employee benefit programs.
Absolutely. Absolutely. Well, and another thing too, just to, looking in my crystal ball, I've been having a lot of conversations lately with some big carriers and even stop loss carrier, everybody that I've been talking to. It appears that this next coming renewal cycle, this January 2023, there's going to be quite a shock. We've been kind of spoiled these last couple of years, very low renewals and things, even on the fully insured market. But what we're hearing is that 15% renewal increases are kind of going to be the floor. Mm-hmm. So this is the time to really, as you mentioned, Butch, this is the time to really start to investigate these things and start to have a plan in place where you can stage yourself. You don't have to make these big sweeping changes all at once. We've got a 7-stage strategy that sometimes takes us 3 to 5 to 7 years to implement completely. But you really, this is the time to really start to look at doing these things now.
100%. I totally agree, because I've heard the same thing, where there's more to come, especially with some more claims coming down the pipe. And so obviously we're going to have more topics such as this. Chris, if anybody wanted to reach out to you, how do they get in touch with you?
I'd say probably on LinkedIn. It would be a good place to start. Otherwise, always visit my website, gbsbenefitsgroup.com. And I don't try to hide myself online. You can always reach me on my cell as well, 253-228-8336.
Awesome. Yeah. And I can be reached on LinkedIn too. I'm Butch Zemar, and the website's elitebenefits.net. And you can find information that way as well. So Chris, this has been good. I look forward to doing more of these with you.
You got it. Thanks, Butch. Likewise.